guys, how are you? Welcome to my channel. I am back to talk about fibroids. Fibroids are the most common uterine growths found in women who are usually about pregnancy age, and most commonly it happens more in Black women than it does in Caucasians. So it is a common thing, but mostly Black women experience it more than Caucasians do experience it. So there are growths in your stomach most of the time, and they don't have any symptoms. They're painless. You may just find out that you do have fibroids after your stomach starts swelling. You have no symptoms, then all of a sudden your stomach starts swelling like you're pregnant, and then when they do an ultrasound, they do find that you do have fibroids. Another thing about fibroids, I do have notes, so I'll be looking at those. They vary in size. Some people have small fibroids, and other people it grows as large as a grapefruit. And those are the ones you'd look at somebody and probably think they're pregnant, and they're not pregnant. It's because they do have fibroids. Most people will get fibroids, most women, not a huge percentage, but most women childbearing age up to perimenopause, menopause will do get fibroids in their lifetime. It's common. They are non-cancerous, so don't worry about them becoming cancerous. They are non-cancerous. Benign is the name they use for it. The most common symptoms you'll get when you have fibroids: heavy menstrual bleeding or painful periods, longer or more frequent periods, pelvic pressure or pain, frequent urination or trouble urinating, growing stomach area. As I said, if somebody looks at you from the outside, they may think you're pregnant, but you're not pregnant. It's the size of the fibroids. Constipation. In some people it does cause constipation. Pain in the stomach area or lower back, or pain during sex. You can get that. Very rarely will they cause severe pain that takes you to the emergency room. Their pain is subtle, and in some people, no symptoms at all. In other people, they get symptoms. Some people don't get any symptoms. So it's not severe pain that will make you land in the emergency room, but it is more noticeable. When do you see a doctor? Most people ask, I don't know if I have fibroids. When do I see a doctor? Pelvic pain that does not go away. When you're having heavy or painful periods that limit what you can do, it's important that you see a doctor, OBGYN or your primary doctor. Trouble emptying your bladder. Ongoing tiredness and weakness, which can be symptoms of low blood levels. In other words, they call anemia, which is meaning of low level of red blood cells. So that's one of the reasons. That one you won't catch it as a patient, but if they do your lab work, they'll catch it and wonder why you're anemic. But you as a person, unless you're having shortness of breath, getting tired easily, it's hard to catch it. Get medical care right away. Or if you get severe bleeding, that's another reason to get, from the vagina, or sharp pelvic pain. That's a reason to get immediate assistance. What are the causes? Some people don't know what the causes are. Some people say gene changes that differ from the typical genes that we have. Hormones, we do have hormones, estrogen and progesterone. They cause the tissue, the lines inside of the uterus to thicken during each menstrual cycle. So that can be your hormones causing you to have fibroids. And they also help fibroids grow. Other growth factors, substances that help body maintain tissue, such as insulin-like growth factor, may affect fibroid growth depending on if it's high or if it's low. This other one is complicated. Extracellular matrix. This is the material that makes cells stick together like mortar between bricks. ECM is increased in fibroids and makes them fibrous. ECM also stores growth factors and causes biologic changes in cells themselves. So that's one of the risk factors. I haven't personally had them, but I've had friends who've had them who had to have surgery to have them removed because they grew to a big size. Now, it doesn't prevent you from getting pregnant. You'll get pregnant. If you have fibroids, you will still get pregnant. But the ones who have surgery to have the fibroids taken are usually fibroids that bother them or have grown to a big size. Because when you do go to the doctor will monitor them, and then if they're bothering you, they will decide if you and the doctor can decide if you want to have surgery to have them removed. What are your risk factors? Race, as I said, rarely does it happen in black people. In white people. I have seen it happen in black people. All the people that I know that have fibroids are usually black. It can happen in whites. I just haven't seen it, and maybe you guys have. I personally haven't seen it. Black people have fibroids at a younger age than do white people have. So some white people do get fibroids. They are also likely to have more larger fibroids with worse symptoms in comparison to the Caucasians. Family history. If your mother or sister had it, you're a risk factor for getting fibroids. Other factors: starting your period before the age of 10, which is pretty young. Being obese is a risk factor for fibroids. If your vitamin D level is low, it's a risk factor. If you have a diet that you eat lots of red meat and don't eat many vegetables, that's a risk factor for you. Drinking alcohol, including beer, seems to raise your risk for getting fibroids. What are the complications that you get when you have fibroids? Uterine fibroids, as I said, on their own are not dangerous most of the time. They can cause pain and they may lead to complications, but on their own, usually not. These include a drop in red blood cells, which I told you is anemia, which somebody is going to find out if they do blood work on you. The condition can cause fatigue due to your heavy menstrual periods. So if you're having heavy menstrual periods and you're getting fatigue, a doctor may say, let's do your blood work, and most likely than not, you're anemic, and they are going to find out what's the cause of your anemia, what's causing your red blood cell levels to be that low. Your doctor may tell you to take an iron supplement to help manage the anemia, or sometimes a person with anemia needs to receive blood from a donor called a transfusion. Usually, if your hemoglobin is less than 7, they recommend you having a blood transfusion because at that point it's critical. Most women, you're supposed to be anywhere from 12 to 14. So if you're that low, less than 7, they're going to order a blood transfusion or recommend for you to go to the hospital to get a blood transfusion. Pregnancy and fibroids, they don't interfere, as I had said earlier, with getting pregnant. Some fibroids, especially the submucosal kind, could cause infertility or pregnancy loss. They may raise the risk of certain pregnancy complications like placenta abruption. They may restrict the fetus from growing because of the size they are taking in their stomach. And then they may cause you to have preterm delivery when a baby is born too early, before 37th week of pregnancy. So you ask, how do we prevent it? How do we prevent fibroids? They are still studying on the cause of the fibroids. So I couldn't tell you this is a way to prevent fibroids. They still need research to find out what's causing these fibroids, but only a small percentage of these tumors need treatment. So there's still ongoing research. You can lower your risk. You can lower your risk of getting fibroids with healthy lifestyle. Try to stay at a healthy weight, get regular exercise, eat a balanced diet, plenty of fruits and vegetables, the usual things we tell people to take care of when they take care of their health. Those are things you can do to avoid getting fibroids. Some research suggests that birth control pills or long-acting progestin-only contraceptives may lower risk of fibroids, but using birth control pills before the age of 16 also is a cause for higher risk for getting fibroids. So it is something to be aware of. There's treatment for it, as I said. If the size is too big, they usually discuss with you and your doctor and say, have it removed. If it's bothersome, if you are feeling the symptoms, they'll do an ultrasound to tell you what the size is. Usually ultrasound will show a great picture of your fibroids. Lab tests, as I had said, if you have a regular menstrual bleeding, they're going to do hemoglobin and hematocrit to check for anemia. And again, anemia is the low blood count that makes you fatigued, tired. Some people get dizzy. So they'll do a blood test to rule that out. They can do hysteroscopy. They can do heterosonography. Those are some of the other tests. They can do an MRI. So those are the tests that they can do. There's treatment for it. Some people will say they want to wait and watch. It's up to you. You and your doctor discuss what you want to do with them. Some people prefer to have them taken out, especially the ones that are big and making you look pregnant. Some people will decide to have those taken off. I've seen people who've had them taken out and were still able to get pregnant with no problem. They aren't cancer, never become cancer ever, so it's not something to worry about. They grow slowly or not at all. So some of them will grow and some of them will never grow. So they do have medications. Some people will take what we call gonadotropin releasing hormone agonists. They treat the fibroids by blocking the body from making hormones, estrogen and progesterone, so that it avoids the fibroids growing bigger. So it will shrink the fibroids and the anemia will improve. What else do they do? They do progestin releasing IUD, so you can have that put in, and it can relieve the heavy bleeding for some people, you know, that's caused by fibroids. It relieves symptoms though. It doesn't shrink the fibroids. So the IUD will relieve the symptoms, but it will not shrink the fibroids. And then some people take tranexamic acid, which helps with pain, but also helps with heavy bleeding. So that's a non-hormonal medicine that can ease heavy menstrual periods, and you only take it during the time of menses. They also have NSAIDs, ibuprofen, Aleve, if you're not allergic to that, or if you don't have any reflux symptoms or bleeding ulcers, then you can take that. What else? They do have uterine artery embolization. There's a minimally invasive procedures that they can do for that, or laparoscopic radiofrequency ablation, where they go in laparoscopically. They don't open you up. They go through a hole and they can ablate them from the hole, and they can see it because they do have a screen. As much as it's going in there, they are seeing it on a screen, and they can ablate it to where they reduce the growth of this. What else can they do? Myomectomy, where they go in and take them out. Your surgeon removes the fibroids and leaves the uterus in place. That's what it is as myomectomy. They can do that laparoscopic too. They don't have to open you up. They go through a tiny incision and they can get that done. Larger fibroids can be removed through a smaller cut by breaking them into pieces, cuts them into tissue. They do an endometrial ablation that also reduces heavy bleeding. So there are many kinds that you can do, and then they have the regular abdominal where they open and take the fibroid out. Some people, if you're beyond your birthing years, they may do a hysterectomy. So whatever it is that you guys decide with your doctor, that's what the doctor will do for you. But they are non-cancerous. They do happen more in Black women. And if you guys have any other topics you want me to talk about, you can put them in the comment section. Thank you. You have a great week. Bye-bye.